Seeing a pelvic floor physiotherapist can play a vital role in building your body awareness. Our bodies go through changes from a young age all the way up to adulthood, and having an understanding of how the system works and coordinate can really help to reduce any occurrence of pelvic floor imbalances. So what are some of the things that pelvic floor therapists can help you with? Some of the more common ones are pressure management that you may be familiar, whether it's bladder or bowel related. So if we're talking about the bladder, are there issues starting the flow of pee or finishing the flow? Do you find that you're sitting on the toilet for a while and nothing is coming out? Do you have really strong need to go to the bathroom and difficulty holding on to your contents, or you're coughing, sneezing, laughing, jumping and running, and then pee is coming out? Or do you notice that you are peeing at night very often, and so, or you're experiencing pain? So that can impact how our bladder is functioning, or our bowels. Are there hemorrhoids or fissures? Are you pushing and straining? Is there constipation or loose stools that are happening more on regular basis? Do you find that you're bloated, or it's hard to empty, or you're constantly wiping? All of those pieces play a role in how the pelvic floors are working, and that can impact them and not allow them the ability to come back to an optimal place where they can do their job. Other pieces that we can jump into is pain. Is there pain with period? Is there pain with a pap test or other examinations? Is there pain with intercourse or insertion or tampon insertion? Is there pain with orgasm? So you can see how we can dive into many different pieces that a person may experience that they never actually bring out to the world or talk about. If there are general pains in the low back that has been going on for years, or abdominal pains, pelvic pains, shooting pains, hip pain can also play a role. Issues with breathing, and you find that it's hard to breathe, or everything is tightening up in the neck when you're trying to take a breath in, can impact our pelvic floors. I often see individuals that are going through their pregnancy and postpartum journeys and all the affiliated pieces with that. We have individuals that are pre or post surgical. If they've had any abdominal procedures, not just pelvic floor related, I would highly recommend seeing a pelvic floor physiotherapist, as it can impact how the core unit system is functioning, which can impact the floors, our pelvic floors with that. Some of the more common pelvic floor related procedures, if there are any bladder surgical procedures or prolapse, lifts of the bladder, if there are any uterus procedures such as a hysterectomy, removal of the uterus or parts of the reproductive system, as well as the rectum, where there are any bowel resections or removals, that can play a big role, as well as if there has been colonoscopies. Sometimes people experience pain, or they find that everything just feels very tight and not relaxed. A pelvic floor physiotherapist can be quite beneficial in helping an individual get a better feel for their body. If individuals had any hemorrhoid removal procedures, or banding of the hemorrhoids, or any form of procedure that required a stitching or repair at the bottom of the floor of the pelvis, a pelvic floor physiotherapist can be helpful in assisting with the recovery piece and reconnecting to the body. Conditions such as endometriosis, interstitial cystitis, PCOS, as well as if there are fibroids or cysts that have been identified in the pelvis, all of those pieces can really play a role as how the body is working together as a unit to do its job optimally. And so we want to learn how to have healthy bowel, healthy bladder habits. What's happening if you are someone who is menstruating? How is your period? What is happening before you get your period in your teens? And then what's happening after when period stops in menopausal time? All of those changes impact the function of the pelvic floors. And so a pelvic floor physiotherapist can actually be a nice little addition that just goes with you through life. You don't necessarily need to see them all the time, but to have a nice understanding how the body works can be very helpful, and what other pieces can impact your pelvic floors, such as your posture or your day-to-day activities, your stress and how you are feeling emotionally as well, and just kind of how life is around you. So there are many different factors that many people would not consider that a pelvic floor physiotherapist can be helpful, but I encourage you to explore and check in. How are you doing? Maybe seeing a pelvic floor physiotherapist can be a nice kind of option for you. And so I hope you enjoyed this video. I hope it's kind of struck a few thoughts in your mind. That's really what this is all about. And on our next video, I would like to chat about what to expect in a pelvic floor physiotherapy appointment, and some of the things and pieces that a pelvic floor physiotherapist may be looking for. So then you have an idea what to expect. And I think that will help with the preparation of your next physiotherapy appointment.